I have to say I'm one of those people who has never once in my life considered the fact that fish pee. I'm Julia Wolfson. I'm an assistant professor in the Department of Health Management and Policy in the School of Public Health. My research focuses mostly on social, environmental, and policy determinants of eating behavior and food choices and diet-related disease, specifically a lot around cooking. And it is my great pleasure to introduce Alicia Cohen, who is a family medicine physician and a clinical lecturer in the Department of Family Medicine here at the med school. She's also an Advanced Health Services Research and Development Fellow with the Ann Arbor VA and a former Robert Wood Johnson Clinical Scholar. The title of her talk is Food as Medicine, Increasing Access to Fruits and Vegetables in Low-Income Communities, which is, I think, emblematic of her research agenda broadly, which focuses a lot on food insecurity, food access, and nutrition assistance programs for low-income individuals and vulnerable populations, which is largely informed by her work as a clinician. Alicia's favorite food is pretty much anything that's freshly picked from the garden. So she's practicing what she preaches. Alicia.
Thank you all so much. Can you hear me? So I actually want to open with a story about a patient of mine. We'll call her Shannon. And when I first met Shannon, she was in her early 20s. She had very difficult to control diabetes, and she also kept on ending up in the hospital. And one of the reasons she kept ending up in the hospital is because she often didn't have enough food to eat, and she didn't have a reliable place to refrigerate her insulin. And one of the reasons that she had difficulty obtaining food and storing her insulin was because she didn't have stable housing. And one of the reasons that she didn't have stable housing is because she didn't have regular work. And one of the reasons that she didn't have regular work is because she kept ending up in the hospital. And I saw this cycle repeat itself over and over again with Shannon and other patients, and was really struck by our inability as a medical system to be able to adequately care for patients because we couldn't address these fundamental unmet needs that were impacting their health. And so much of the work that I do is on trying to find ways that we can better address these unmet needs, sometimes called the social determinants of health. And specifically, I look at food insecurity, which is what I want to talk with you about more tonight. So what is food insecurity? We hear that word a lot. There's actually several definitions, but one used by the USDA is limited or uncertain availability of nutritionally adequate and safe foods. And looking in the U.S., about nearly 1 in 7 adults and 1 in 5 children are living in food insecure households. And Michigan is actually, unfortunately, doing slightly worse than the national average. And I also want to draw your attention to the fact that even right here in Washington County, this translates to almost 50,000 people who are food insecure. So one of the ways that the federal government tries to address food insecurity is with the Supplemental Nutrition Assistance Program, or SNAP. This was formerly the Food Stamp Program. And SNAP has been shown to help address food insecurity. However, many people still struggle to afford healthful food, even with SNAP. And these people also bear a disproportionate burden of diet-related diseases like diabetes and obesity. And so one promising initiative that's been gaining increasing attention are SNAP incentive programs, which help to address financial barriers to affording produce by matching SNAP funds spent on fruits and vegetables. Often it's a one-to-one match. And here in Michigan, we're lucky to have the Double Up Food Bucks program, which is actually one of the oldest and most established SNAP incentive programs in the country. It's currently accepted at over 150 farmers markets and 80 grocery stores across Michigan. And through prior research, we found that one of the barriers to people using this program was that a lot of people who are eligible didn't know about it. So one of the things that we set out to do was, I'm a doc, so we decided to do an intervention in the waiting room of the Ypsilanti Health Center. And we wanted to see if just simply increasing awareness about Double Up and letting people know that it existed and they were eligible could potentially help increase use. So we worked with 177 SNAP enrolled adults in the clinic. I just want to note, of these 177, 80% said that they were experiencing some form of food insecurity over the prior year. And then we did a brief informational session about Double Up. We provided written program materials, a map with the farmers market locations and hours. We gave a $10 farmers market voucher just to kind of get them started the first time. And then we surveyed participants 4 times over the next 5 months about their Double Up use and also their fruit and vegetable consumption. And so what we found was that at baseline, only 18% of participants had used Double Up, even though all were eligible for it. And 3 months after the intervention, 69% of participants reported using Double Up at least once, and a third said they'd used it 3 or more times. We also found that there were clinically and statistically significant increases in fruit and vegetable consumption, and this was actually sustained 2 months after the farmers market season had ended. And we also found that essentially the more people used Double Up food bucks, the more often, the more their fruit and vegetable consumption increased. So in short, essentially this really sort of quick and dirty, brief educational intervention in the waiting room of a clinic was associated with an almost 4-fold increase in use of Double Up and these clinically significant increases in fruit and vegetable consumption. So what does all this mean? Well, one, sort of thinking about there's really kind of an untapped potential to use the waiting room when patients are sitting there anyway as a way to potentially deliver really important and helpful information, which, for me as a doc, again, is a really important thing, and I think for all of us. And that being said, there's still really a need to better understand how we can address and reduce the remaining barriers to use among the people who weren't able to use Double Up. And then finally, thinking about, what are some other opportunities for clinics to address unmet need through connection and collaboration with existing community programs. Because there's a lot of resources out there and clinics don't have to reinvent the wheel. And so our hope with this project is that by continuing to foster these clinical and community collaborations, hopefully we can get one step closer to helping increase access to food as medicine. Thank you.